I'll make this brief because I know you've got to get to the really important bit, and that's getting the opportunity to answer the questions and everything that's kind of burning on your fingertips and things that you need to know. So, but I did want the opportunity just to say a huge welcome to everybody who are starting on their journey today. It's fantastic to have you join us at the National School for Healthcare Science. I'm Professor Delia Ripley. I'm the Deputy Chief Scientific Officer for Workforce Training and Education, and also the Head of School for the National School for Healthcare Science. So really excited to be here as you start your journey today, your learning journey, and also to see how your role develops and how you develop, and how important really, which I want to underline in just the next 10 minutes or so, how important your role is to the wider healthcare science arena as well, and how you're going to be fitting into that much bigger picture of innovation and patient care. So next slide, please. So firstly, huge congratulations to everybody here. You've been selected to join this programme that not only helps to build your expertise, but also develops you as a professional, and also places you right at the heart of transforming cardiovascular diagnostics and being part of the NHS. And it's in a really exciting time, actually, as we shape and flex towards a new way of working in the NHS. So you're going to be part of a real growing community of professionals that are going to make a huge practice to patient care going forward. So just take this opportunity in time to congratulate yourselves for getting here. And as I said earlier, really looking forward to seeing you all embark upon your journey and flourish over the next 18 months or so. So next slide, please. So I did just want to talk a little bit about the kind of wider sphere of healthcare science. Now, we know healthcare science, how important healthcare science is. It touches all corners of healthcare delivery for patients. And just to give a bit of a scale of the healthcare science workforce, we have around 60,000 healthcare scientists within England. There's around 7,000 in Wales. There's slightly more in Scotland, slightly less in Northern Ireland. And so actually collectively, we make up, a sizable part of the workforce, about 5% of the workforce of the NHS. But also, I think what's different is that we all have our specialist areas, but there are so many different specialties across healthcare science. Now, whilst we are very different in our specialties, I think we're all united in the fact that we all have the same ambition, and that's to provide the very best care that we can for our patients. Now, as the slide says here, most of our staff work in the acute sector, and more than 90% in diagnostics, and that's very much what we're talking about today. But other healthcare scientists we have working in a variety of other different fields as well, such as rehabilitation, therapeutics, research, innovation, all sorts of different areas. And it also says here on the slide that healthcare scientists contribute to over 80% of clinical conditions, or over 80% of clinical decisions are based on the information that a healthcare scientist provides. I actually think that's quite a conservative figure, because there aren't many patient pathways that healthcare scientist doesn't come into contact with. So regardless of our specialty and regardless of where we sit in the system, we're part of a much bigger family, all contributing to delivering the highest quality patient care that we possibly can. Next slide, please. Okay, so I did mention that now's a really exciting time to be joining the NHS. For those people who are new, I know some people who aren't new to the NHS, but it is an exciting time regardless. So as we know, back in September, Lord Darzi published the independent investigation into the state of the NHS and what needed to change in order to bring the healthcare to bring the NHS up to a standard that will be fit for purpose for the future. And that launched a second piece of work that the government set out back in April this year, which was a really huge consultation of public, patients, professionals, asking everyone to input into what would make our NHS fit for purpose for the future and able to cope with some of the increasing demands that undoubtedly we will see in terms of burden of patient care. So that timeline's now shifted, and we saw the publication of the 10-year plan, which was a result of that consultation, and that was published back in July this year. And we've moved on even more since then. So we're now looking at the delivery plans associated with that 10-year plan, including the cancer plan and the workforce plan. So these are due to be published a little bit later this year. So we're moving on in terms of how we're going to shape the NHS going forward. Now, the 10-year plan was not about doing the same thing differently, doing the same thing to achieve the same results. It was about doing things differently. It's a real bold, ambitious new course of action for the NHS. But what's quite clear within that 10-year plan is that science and technology, innovation and diagnostics really sit at the heart of delivering that plan. So in order to make sure that we deliver better outcomes for patients and a better service, also better economic value in terms of investment of taxpayers' money, it's really, really key to the plan that healthcare scientists are going to be integral to driving 3 strategic shifts, which are going to help us get there in terms of changing the NHS for the future. And those 3 strategic shifts are moving from hospital to community. So we know that our hospitals are very much under pressure, and we know as well that more can be done to help people to empower individuals to take more care of their own health, but also to treat patients more close to home. So obviously that's better for the patient, but also takes some of the pressure off our really stretched acute services as well. So one of the ambitions of the 10-year plan is to move from hospital to community. And for your profession particularly, this has already started happening, but what do we need to do to increase that more? And I think there's some really exciting opportunities as we think about treating patients out of the hospital setting in the future. Also, seizing digital health and digital technology to improve the way that we treat and manage and diagnose patients. I mean, there's lots and lots going on. Digital sphere imaging, for example, is really revolutionizing the way we diagnose, speeding up time, making efficiencies, productivity gains. So that shift really is about how can we seize and make the most of those tools that are available to us. But also sickness to prevention as well. So making sure that perhaps we move away from the medicalised model that we have at the moment, which is waiting for individuals to become ill and then treating the problem at the end, but actually instead looking at further upstream to see what we need to perhaps put in place to prevent that kind of illness or sickness from happening. So how can we put in more preventative measures? Now, these are really key shifts, and we know that healthcare scientists are already driving some of this, but are going to be increasingly important to driving this forward in the future. So that's why it's such an exciting time to be at in the NHS and really standing on the precipice of this strategic change. Next slide, please. Okay, so I've talked a little bit about innovations that are changing the way that healthcare is delivered and experienced over the next decade. Actually, many of them are here now, but we're going to be seeing this more and more and more. So just to pick out a couple, I mean, we know that we've got so diagnostics, for example, we know we've got genomics. I have no doubt that genomics will completely change the way that we diagnose and treat and manage patients in the future. We've got things like next generation sequencing, whole genome sequencing that allows us to provide more personalized care, that allows us to perhaps shorten some of the patient pathways that we have at the moment for cancer. For example, we've got things like liquid biopsies that may prevent some of that traditional biopsies from taking place and speed the time that taken to get a diagnosis and obviously access to treatment for patients. So this is just one area that's really rapidly expanding, but AI as well, and some fantastic examples in pathology, for example. We have AI that's looking at prostatic cancer slides and picking up the really, really tiny foci that are very difficult to pick up with the human eye. And actually, they are increasing the pickup rate, they're speeding up the time taken for diagnosis, really having a huge impact on decreasing the waiting lists and allowing our clinical staff really to stratify into the highest risk areas. So really making significant shifts in the way that we treat and manage our patients for the better. But also there's many others of these kinds of developments that happen. ATMPs, many of you would have known about CAR T cell therapy and how that has been changed by the access to advanced therapeutic medicine. So we need more of these types of therapies and more of these types of developments. And what's going to be key is, well, you're going to be working in the NHS and you're going to be key to leading this, driving it, working amongst it. So again, I think it really is an exciting time to be part of the NHS and part of patient healthcare delivery. Next slide, please. Okay, so this was really just to kind of demonstrate that wider shift. So historically, we've had a one-size-fits-all kind of treatment approach. And the example that's given here is patients with colon cancer. So perhaps historically, we've given the one therapy for colon cancer, and it's had variable effects in different patients. So in some, it's been effective. In some, it hasn't been effective. And in some, it's actually given them some adverse effects. Rather than having that one-size-fits-all approach, in the future, in the advent of now having more diagnostic information and diagnostic sequencing, we are better able to match up the right therapy for individuals who we know it's going to have a positive effect on. Now, not only will that speed up the time taken for that individual to receive that treatment, but also it will negate any negative effects and will allow us to really give that patient the very best opportunity, prognostic opportunity that we can, particularly when they're suffering with a condition like colon cancer, for example. So definitely the future of healthcare is changing, and we have all of these tools right at our fingertips. They're constantly evolving. Next slide, please. And this was really just to talk a little bit about some of the evolving technologies, that AI, genomics, robotics, digital therapeutics, looking at how we can use digitalized records and also predictive analytics that will help us to, again, be more tailored in how we treat and manage patients. So all of these advances, we are actually benefiting from many of them. But the future is already here, but actually it's developing more and more. So you will see more of this in your area of practice. And I think it's a really positive thing as we can help to improve the way that we deliver services to patients. Next slide, please. Okay, so that was just a little bit about the wider sphere of healthcare science, a little bit about your training journey. I won't labour this too much. I know Sally's spoken to you really in depth about this. Your plan is probably thinking that you want to get to that finish line and there's kind of a clear trajectory, but it won't be any surprise to know that actually in reality there may be some ravines, some obstacles to come across, some kind of bridges to encounter, but actually it's going to be rewarding. You're going to gain clinical skills, academic knowledge, you're going to grow as a professional and grow in confidence and expertise. And you're going to be supported every step of the way by your training officer, your university, and also by us, the National School for Healthcare Science in particular. Next slide. So Sally's already touched on this about the National School, but just to say that the National School was set up back in 2011, and it was set up to secure excellent training for the NHS, training and education, which it still does. And there are a variety of different components of the National School, and all working really to support your journey. So everything from training support and train the trainer, resources and managing meetings and inductions, accreditation and working with training sites, universities and programs to make sure that we have those standardized, good standard of education and training that's needed for our healthcare science professionals. We hold the curriculum library. We also perform the assessment functions and also the digital element in terms of the e-portfolio and web resources and all the good things that we've spoken about today. So the National School will really provide that support as you continue on your journey. Next slide, please, Sally. But not only the National School for Healthcare Science, we collaborate with others really very closely. So you're actually part of a network who are all invested in your education and training. And that might stretch from, your training officers and networks to the healthcare science community, and also those who are working out in practice that are involved in shortlisting, interviewing and assessment and helping us to keep our curricula up to date. But also professional networks as well, as we work really closely with the Office of the Chief Scientific Officer, who's head of profession for healthcare science in England, and also the Academy for Healthcare Science, that overarching body, our regulators, and a range of others as well, including academic partners that provide the academic learning, and also the commissioners who provide the support and the finances that support the programmes too. So there's a wide variety of support from through the school, and much wider, to make sure that your education and training is the best that it possibly can be. Next slide, please. Okay, so just to finish up, your top tips really for success. You're not alone. You're going to collaborate with trainees, educators, assessors, professional bodies. My top tips would be collaborative and be curious. Keep that scientific inquiry in mind. Ask the questions, even if you think it's a daft question. Take the time and ask the question. But also get to know your training officer, and really importantly, get to know your peers as well. That's really, really important for that support as you move along, and you can go through those actual obstacles and navigate through them together. I think that makes for a much more enriching experience whilst you're on your journey. But definitely, I would advocate for healthcare science. Let people know what you do. As healthcare scientists, we're often really, really bad at advocating for ourselves, at telling people of the jobs that we do, and the real impact that we have on patient care. So you are a pioneer. Be prepared to be a pioneer. Pioneer for yourself. Pioneer for your profession. You really are helping to shape the future of cardiac diagnostics, and that really is something to be proud of. So embrace the journey, and don't forget to always ask for help if you need it. Okay, so that's really it from me from today. Just to reiterate, huge congratulations and a very warm welcome, and I shall pass you back to Sally now to continue with your panel discussion. Thank you very much indeed.